Hi, my name is Dr. Talia Markajani. I'm a naturopathic doctor practicing in Bloor West Village in Toronto, and I have a special interest in mental health and hormone conditions. I'm particularly passionate about working with youth in mental health conditions. So as many of you know, I have the opportunity to work with some street-involved youth in downtown Toronto at the Evergreen Yonge Street Mission as a naturopathic doctor in the drop-in health clinic there. My patients there are age 18 to 25. Many of them suffer from psychiatric conditions, mental health issues such as depression and anxiety, bipolar disorder, schizophrenia, sometimes psychosis, and oftentimes addictions. In my private practice, I see a lot of patients with depression and anxiety, and a lot of youth suffering from psychological and emotional stressors. I'm so passionate about working with youth because I find that working with mental illness can help us set the stage for health in the future, and especially setting the stage for mental health and emotional health literacy in the future, creating empowered adults. There's an increase in psychiatric diagnoses in youth, especially an increase in prescriptions to youth for mental health conditions. These prescriptions are prescribed to youth to correct brain imbalances and setting the stage for a future of health and balanced brain chemistry. However, this is the story that we've been told. But when we look at the research, we find that, first of all, there's no research to show that depression and anxiety is the cause of inherent brain imbalances, chemical imbalances in the brain in anybody, so let alone youth. And we also see when we look at the studies that while these drugs can help some people, so some people will say that they couldn't get out of bed without these medications, and these medications saved their lives, and that's totally valid for them and their experience. But when we look at actual studies, we find that there's not very much benefit in taking these medications in people with depression and anxiety, and the benefits in youth is even lower. What we also see is that over the long term, the disability from mental illness increases with people who are taking medications. And what we see in youth too is because these drugs induce a brain imbalance, so things like SSRIs for depression, like Prozac, or benzodiazepines for anxiety, something like lorazepam or Ativan, that these drugs actually induce chemical imbalances, and some of them are very addictive and difficult to get off of, and some of them can even set the stage for worsening mental health conditions. Because of these brain imbalances, we see that, especially children and youth who are prescribed Ritalin at a young age, or SSRIs like Prozac or citalopram, they're seeing a rise in bipolar disorder and worsening mental illness in these populations, and so that's a big deal. And it's particularly worrisome because we think of how youth, they don't have fully developed brains until the age of 25. So as a naturopathic doctor, I like to look at why people are experiencing the symptoms that they are, especially when it comes to a mental health condition. I think that depression and anxiety are symptoms. So they're often indicators of underlying imbalances in how our body's functioning, because there is no test you can take to see if you have depression or anxiety. It's all based on symptoms and patient subjective experience. And since we know that it's not caused by an issue with your brain and that you're not born with it, we have to look at other reasons why. It can be a wonderful opportunity because when we look deeper beyond mental health symptoms, we can learn more about our bodies and begin the journey to amazing health and wellness. And when I'm working with youth, this health and wellness and, as I mentioned before, mental health literacy can expand into their adult years, changing the course of their lives, and hopefully, because we're working with a new generation society.